Om Shanti Benji. Thank you very much for your knowledgeable and essential talk. We are very much blessed by your wordings, and I hope all our members of this webinar will keep them in their mind. Thank you very much. Now, I request Dr. Rajshekhar, brother, to please give welcome speech to all. Dr. Rajshekhar, you all know, he is the director to this institution and he has been in connection with the Brahma Kumaris since so many years. And he always cooperates. When I asked him for the first time, he again agreed for that and he has arranged for this program. Thank you very much. And I request now Dr. Rajshekhar to give his valuable speech.
Dear viewers, today we have a webinar on holistic health for peace and happiness. Can we have a better time than now during COVID epidemic to discuss about happiness, peace and holistic health? I bring greetings and felicitations to all of you from staff and students of USM KLE International Medical Program, Belgaum. I sincerely thank Vidya of Brahmakumari Vishwavidyalaya of Belgaum Center for having taken initiative for conducting this webinar program. I appreciate their passion and commitment to bring awareness of holistic health. This is an appropriate time for such an event. Brahma Kumaris are doing commendable job all over the world in awakening spirituality in one's life. I also thank speakers Rajayogini Brahma Kumari Meera Didi, head of Brahma Kumari Center Malaysia, for sharing their views. I also appreciate the interest shown by Dr. Muralendran Mariyappan, head of Robotic and Intelligent System, University of Malaysia in Sabah. I also appreciate and thank Dr. Hema Orman, physician of Malaysia, for assisting this and sharing his experience. Both these speakers are associated with Brahma Kumari in Malaysia. I am a teacher in medicine and a physician practicing for the last 55 years in Belgaum. I am a very strong proponent of holistic medicine. Ask person, why should we be interested in this holistic health? Why should we know whether we are healthy or not? All of you are aware, health is wealth. Health is progress. Health is development. I strongly believe health is a divine blessing. Health is defined by the World Health Organization as physical, mental, social, and spiritual well-being are not very unfortunately for many of us, what is that? Without disease, we are healthy. It is not so. Apart from this definition, psychologically and emotionally also healthy. And WHO ordered that those health people should lead socially and economically. Do get help from doctors?
Vidya Ben, can you ask the audience to turn off their mobile, their sound, unmute the sound and mute the camera because it's disturbing. When we can't hear clearly, Dr. Rajendran. Please make the announcement.
Pharmacy shop can give you medicine, but they cannot give you health. Then where do you get health? Health is something you have to do yourself. It should be a personal investment. One should be very passionate to be healthy. You had to practice and practice every day, sustained level. It is not possible to be healthy by listening to lectures or webinars, reading newspapers, reading books on health. One has to practice it every day to be healthy. It is very unfortunate and painful to know that allopathy is a science of disease and not science of health. There are millions of doctors and lakhs of hospitals all over the world who are doctors of disease and very few doctors of health who talk about positive, promotive health. Allopathy philosophy is based on biomedical reductionist model. Unfortunately, we learned and taught this philosophy to medical students for so many years. We consider our body as a machine, a complex matrix of muscle, blood, bone and nerves. If this machine is disturbed, we investigate the machine, correct the deficiency by giving drugs or splints or operations and so on and so forth. But allopathic system as a whole did not understand that this machine also has mind. This machine also has soul. Since we didn't understand the role of mind and soul, we did not share this information to medical students. And generation of students for the last 50-60 years in India are taught such medicine. They do not know the value of mind and soul. It is important that to have holistic health, one should have three dimensions. Health is three-dimensional: physical, mental, and spiritual. When all these three dimensions flow harmoniously, sync with circadian rhythm, one will be healthy. In modern medicine, we treat a disease, a symptom or a sign without understanding human being. Human being, he is not yet a symptom or a sign, but he has mind and soul, emotions and so on and so forth. Modern medicine has understood only physical dimension of health, like we say healthy diet, quality sleep, exercise, and then we give drugs. If that was to be so, why do we have so many diseases happening today? There are so many lifestyle diseases. We are giving medicine to them, but they are not getting cured. They have to continue medicine throughout their life. There is some inadequacy in understanding and practice of medicine. Health is also a mental dimension, where we have thoughts, emotions, memories, samskaras, we have fears, we have hopes, we have beliefs. If we don't understand all this, we cannot understand the role of mind in keeping the person healthy. Apart from physical and mental dimension, we also have a spiritual dimension of health, which is very important nowadays, where person is peaceful, loveful, pure, happy, compassionate, altruistic, is contented, is happy, and is powerful. If you don't understand these qualities, this compassion and these dimensions, one cannot be healthy. Hence, holistic health must have physical, mental and spiritual flow of energy to sync with harmony of the circadian rhythm. In India, we have an ancient system of medicine, what is called Ayurveda. The father of Ayurvedic medicine, Charaka, 3000 years before, that is 1000 BC, enunciated 5 principles to be happy and also to have a positive promotive health. This is called holistic health. He enunciated 5 principles like ahar, which is food, what sort of food? Sattvic food, consisting of whole grains, pulses, milk and milk products, vegetables, nuts, fruits. Only vegetarian food, which helps in sattvic way of life. Second principle is achar, is conduct. How do we conduct with our relatives, friends, colleagues, wife, children? There is a social component of health. Vyavahar, also called interrelationship between human beings. As a doctor, how do you behave with the patient? As an industrialist, how do you behave with an employee? A businessman, how does he behave with the clients? What sort of profit motive he has? And so on and so forth. It's called Vyavahar. Fourth dimension principle is Vyayam, exercise. You must exercise every day to keep our body metabolism good and allow the hormones to be secreted, to be healthy and happy. Not the least dimension or principle dhyana or meditation, which is the most important component of contribution to holistic health is meditation or dhyana, where we become spiritually minded individual, we become calm, serene, quiet, peaceful, loveful, happy, contented. With all these, we get good hormone secretion and good metabolism and a healthy mood. All these 5 principles must be practiced religiously every day. Then only one can get holistic health. If you are holistically healthy, you are also peaceful and very happy. If you don't do all this, since we have not done the last 40-50 years, today we have 70% diseases are non-communicable diseases, which are based on our lifestyle. Diseases like hypertension, diabetes, heart attack, paralysis, cancer, sleeplessness, suicide, depression, irritable bowel syndrome, peptic ulcer, backache, anything you take now today, they're all related to our lifestyle. And our lifestyle depends on our attitude, behavior, habits, addictions, and so on and so forth. Hence, mental and spiritual dimension of health are very important for promoting positive health. Then only one can have holistic health. It is important for us to understand the role of the mind and soul and interrelation, that is mind, body, medicine is very important today. Hence, this seminar today is going to highlight, our speakers are going to highlight, they are all members of Brahma Kumari Center in Malaysia as well as in India. They are going to highlight role of spirituality in peace, love, happiness and holistic health. I once again thank all of you for having attended this webinar session. I once again thank all my speakers from Malaysia and Brahma Kumaris for having taken this initiative. On behalf of USM Kelly Medical College, I am very happy to be part of this program. I really appreciate and very happy over this. Thank you.
Thank you very much, Dr. Rajshekhar. You are so kind enough to give us a chance, and along with that, you also have increased our knowledge regarding health as well as holistic health, which includes both physical and mental levels of health. I thank you very much, Dr. Rajshekhar. Now, I request we are very delighted to have Mr. Dr. Murlindran Mariyappan as our main speaker. We are happy to say that he has a very huge profile. I am very glad to read all these things because he is having so many awards. He has so much of skills in him, and brother is a head of the robotic and intelligence systems in Malaysia University. He also is considered as the cluster head of physical competition and physical computing for digital maker. He has made more than 130 publications. He has trained the PG students as well as doctorate students, about 30. He has got 35 medals for his work done for the research and innovation in local and international levels. He also has been awarded with International Invention of the Year 2015, a Platinum Award at the British Invention Show in London. He has been awarded the Gold Medal, and also he is considered as the STEM Training Innovation Award he got at the Malaysia Technology Expo 2019, Kuala Lumpur. He is a trainer, he is advisor for the UMS Robotic Club and team manager for the UMS Robotic team. He is a winner of 10 National Robotics Award in the competition, in different competitions. He also has represented Malaysia for different programs and intelligent programs in governments, at the ministries and different universities. He also has led the training and is a leading trainer and module developer in educational robotics. And he also has got many other awards. He is a member of 12 professional affiliation and founding member and executive committee member of the International Federation of Automatic Control, Malaysia, National Member Association organization. He is also a keynote speaker. He also is associated socially and communally with different aspects. He is a medical practitioner, meditational practitioner for the past 24 years. Raj Yoga meditation teacher also he is, and he is coordinator of Peace House Brahma Kumaris at Sabah. He is honorary secretary, assistant secretary of the Brahma Kumaris Malaysia, and he also has been a life member and official speaker of Sabah in Malaysia, the Anti-Drug Association. He is organizer of many different programs. He is a recipient of exemplary service award from Malaysian Hindu Sangam. So that way he has so many different and vast degrees, and he has done his work in such a way that the whole Malaysia is grateful to him. May I kindly request you, sir, to please share some words with your knowledge, experience, and the meditation practice. Over to Brother Murli.
Thank you very much, Sister Vidya. Thank you for inviting me. And also very good morning to Dr. Rajshekhar and also other speakers. And selamat pagi to all the students from Malaysia. Okay. Now for the benefit of the Malaysian students, I will mix my speech today with Malay and English language. Okay. The slides will be in English, but I will generally speak in Malay language. Okay. I would like to share with you some different dimension today, like what Rajshekhar was sharing, that holistic health also covers many aspects. Now, if we see into this aspect of the today's topic, got two things. The first one is holistic health. Okay, kesihatan menyeluruh. And then the second one is peace and happiness. So you can see this iceberg. Whatever we can see is only the top of the ocean. But what is underneath is a big tank. Okay? So when you talk about holistic health, sometimes we only deal with the top portion. But now today I will share my experience of what is it about. Okay, before we start, Dr. Hemaf will share with you deeply about the physical aspect and also the other holistic health. Basically, as what Dr. Rajashekar has mentioned, holistic health, it covers physical, social, mental, no, emotional, and also spiritual health. No? Now, when we talk about physical health, of course, we want to make sure we have a balanced diet, sound breath, sweet breath, sound sleep, regular activity. We can go to the washroom, and our blood pressure, BP, is under control. All our organs are function properly, and also most of the aspects that the only doctors will know. But when we look into the mental health, of course, we will look into the aspect of happiness, kegembiraan, no? Calmness, cheerfulness, no? And then one more aspect that we need to pay attention is that self-satisfaction. No? We must have self-respect in our life, keyakinan diri. No? And also we should not have self-condemnation or self-pity. And also we must have an accommodative intellect. We must accept criticism, not to get upset easily. We understand the emotion of others' needs, no? And we must be open, terbuka kepada all the new ideas. Another aspect that we need to look into on this mental health is that we must have self-control. The self-control comes in the aspect of we should not be dominated by these emotions, negative emotions like anger, fear, attachment, jealousy, guilt, worry, and not driven by greed and lust. So these are the aspects that we should pay attention on self-control. And then another thing is that we must be able to face challenges, masalah, all the problems, and we have to solve them intelligently. Of course, when we talk about the social health, of course, we need good friendship, which is satisfying and lasting. And also we keep our family and social relationship happy and also frictionless. And also we need to do some act of benefit to the society, but in accordance with our real capacity. So these are the top part of the aspect that we can actually see, the tip of the iceberg, no? But the bottom aspect is our spiritual health. In Malay, they call it kerohanian. Okay. So now this kerohanian, one aspect is we must have accurate knowledge, and we must constantly experience the awareness of our original qualities, like love, peace, happiness, all these things which I will share later. And then a sense of brotherhood. The whole world is like saudara, family. And also we must have an intellectual or constant communion to the Supreme. That's what many of us do. We do prayers or meditation or what. So when this is constant, now this will give us spiritual health. Okay. So now the question is, I want to ask you all. Okay. Basic question. Soalan asas. Okay. Now, when we talk about peace and happiness, kedamaian, kegembiraan, soalan yang saya nak tanya, I want to ask, who is the one who wants peace and happiness? Siapa yang hendak kedamaian dan kegembiraan? And then, what is peace and happiness? Why? Kenapa kita semua cari kedamaian dan kegembiraan? And bagaimana untuk experience this peace and happiness? So these are fundamental questions that we are going to look into today. Okay. So the first question, most important question: who wants peace? Your body wants peace, or the living being in your body wants peace? So we have an identity that we have seen that we always identify ourselves as bodies. But I want to share with you some deeper aspects. We are all actually a living being. In Malay, they use the word jiwa. No? When you use the word human being, the human actually refers to the body, and the being refers to the soul. So this living being you can compare like a car and a driver. This physical body is actually a vehicle that the driver is driving. No? Who is thinking when the car is moving? Who is making the decision to turn? Who is creating the destination? So the jiva, the soul inside the body, is the one which is driving, memandu our body. And then we are the one who is thinking. The mind is thinking, one of the faculties of the soul. And we are the one who is deciding, the intellect. And then we are the one who has the memory or impressions. Okay. So we are actually a living being in this physical body. So this is the most important aspect that we need to understand. We are a soul in this body and having experience. No? Because the body without the soul, a jiva without badan, like a dead body, doesn't have any feelings. If you go and speak to the dead body, it won't reply to you. So basically, who is speaking? So the living being in the body, the jiva, that's what is speaking through the body. It is listening to the ears, speaking to the mouth, and feeling, experiencing and expressing through the body. Like the driver, pemandu, bila dia bawa kereta, when he's driving, so initially when we were learning how to drive a car, we will always think that, if there's a pothole, we might put the wheel into the pothole. Because we feel very different from the car. But after driving for so many years, we will come into an understanding that the moment we get into the car, we become the car. So if there's a pothole on the road, we can move in such a way that we don't go into the pothole. So same like that, our consciousness has changed. We are a living being in this body, but we became conscious of the body more than being a conscious of a living being. Now let's come to the second question. What is peace and happiness? What is peace and happiness got to do with this me? When I say I am a living being in this body, what is it got to do? Because this peace and happiness is actually the original qualities, the 7 original qualities of the living being, of the soul. Peace, love, happiness, bliss, power, knowledge, love. Now, all these 7 qualities of the soul is actually, is what we say that it is the qualities of the soul. It means we actually are there. If sugar is sweet, we are peace. And that is why I want to share with you the third question. Why are we searching for peace? Because we have lost it. We forgot that we are a being of peace, a being of happiness, a being of love, a being of bliss. We forgot about all these things. Now, bila kita lupa semua ini, then kita search. Nobody will search for something that they have not lost. I imagine I lost a Rolex watch, and then I go and look for Casio watch. I won't look for that. So I only look for something that I've lost. So I have lost my original qualities, the awareness of my original qualities. Okay? So what I do? I go and find for temporary peace, temporary happiness, temporary love, which I can get from outside, which is not everlasting. Right? So when that happens, we go into different form of consciousness. So when I tend to identify myself as body, then I will resort to what we call it vices. Kesedaran badan and also kesedaran jiwa is 2 different consciousness. So when I am soul conscious, when I bring myself into the awareness that I am this soul in this body, saya adalah jiwa, then automatically I can experience peace, love, happiness, purity, bliss, power, wisdom, which are my original quality. But if I tend to identify myself as this physical body only, not a living being in the body, using the body to experience and to express, then I will resort to the vices to solve my daily problem. You know, when somebody makes a mistake or somebody creates a problem or creates an issue, we become angry. No? Or we use anger to solve the problem. Why? Because we lack the experience of peace. No? Anger is an absence of peace. So when I have more experience of peace, my peace will become powerful. And I can use peace to overcome my daily problems. I don't need to use anger. If somebody makes a mistake, I don't need to shout at them or scold them to correct them. If I scold them, they may look like they're changing, but they are not changing. They're temporarily satisfying your needs. Okay. They're not changing. But why, the question comes, why I cannot use peace, I cannot use love, I cannot use happiness to change another person or advise another person or to correct another person? Why? Why I need to resort to these vices? Because my love, my peace, my happiness doesn't have the power. Because I don't have the real happiness of peace. Imagine if I get a new handphone baru, and then I gembira, I am happy. But after some time, the kegembiraan tu hilang, lost. Then what happens? I get new handphone, then makes me happy again. Then it's lost. See? But if I can experience myself as a living being, as a soul, in this physical body, then I can experience the real happiness that I am. So my kegembiraan comes from inside, dari dalam, no? Not dari luar. Okay? So these are the two things that I would like to share with you. Why? And also, how to experience peace and happiness. How actually? What are the methods that we have? So today I would like to share with you one method of experiencing peace and happiness, which is meditation. Well, many people have different way of understanding what is it all about. But you see, when those people who are practicing meditation, meditation is like actually an art. Meditasi adalah satu seni. Like even if you practice silat, taekwondo, karate, or swimming, or boxing, or archery, it's a skill. So meditasi is actually a skill, a seni. Okay? And this seni, this art, actually provides inner healing. Because this art deals with your thinking ability, your mind, your consciousness. Okay? And anybody who practicing any seni, they have to have a very positive lifestyle. If a person wants to learn martial art, if he wants to represent the country to go and fight in the international tournament, he has to have a very proper positive lifestyle. No? If we are chincai only, anything, bila-bila want to practice, he can practice, or bila-bila dia nak fight, dia boleh fight. So I think that won't work. Okay? And meditation is a skill where you have mastery over your mind. You can train yourself to think what you want to think, what thought you want to create. No? And express into words and actions, you can actually have full control over your sense organs. And when you have full experience of the qualities of the soul, then you can overcome all your bad habits and vices. So this is the benefit of what is meditation is all about. So I want to share with you a 3-minute video. Okay, so I want all of you to sit relaxed. Okay, calm yourself down. Breathe in deeply and slowly. Okay, so that your thoughts slows down. And for this 3 minutes, try to see and try to follow this cartoon video. Okay? Right?
A quiet space. Deep breath and gently allow your whole body to relax. Become focused by moving your awareness into the center of your forehead. This is the seat of the soul. Focus on this point. Within this silent and still space, awaken a spiritual thought. For example, I am a peaceful soul. Hold this thought. Don't think hard about it. Allow your mind to wrap itself around this simple positive thought. I am a peaceful soul, a being. Simple positive thought. I am a peaceful soul, a being of peace. Hold this thought in your mind and allow your heart to experience it. Reaffirm the thought in it. Say it again to yourself and deeply experience it. As I hold this thought, I become the form of the thought. I am completely absorbed in the experience of the thought. This is meditation.
So just now we have experienced what is meditation, a little bit of experience. So what is the result? If you really want to know some of the results that I want to share with you, general results, and so immediately what we will get is that we will have our inner strength improved. We will have a lot of clarity in mind. Ketenangan jiwa. In Malay, they use the word ketenangan jiwa, peace of mind. Okay. And then we can experience our natural qualities. Of course, definitely we will have physical and mental relaxation, and we have control over our mind. Now, this one, ini satu contoh, image MRI. Bila seorang itu dalam kesakitan dan also dalam keadaan meditasi. Okay. So this one is from this university research. So as you can see, when a person is meditating, the amount of pain reduces. Okay. It's proven. Okay. And also brain waves. Bila seorang itu bermeditasi, the amount of signal that they generate is very low. So when people experience deep meditation, it is almost, the brain wave is almost similar to deep sleep. But the difference is you are aware. And the practice of Raj Yoga meditation, one of the benefit of that is we do open eye meditation, where we meditate with our eyes open. That means saya boleh lihat, I can see, I can hear, I can feel, but my mind, minda saya, is in a meditative state. So this is something very unique, a very unique experience that meditators have. Okay. Now this is something I want to share with you also. Equation and health equation. Now, if you look at this chart, this is a simple chart to explain. So, semua orang, everybody has a threshold in ourselves. Depends on our lifestyle and our internal ability. So the percentage of us to handle the stress, assume it's A percentage. If I cross, I melimpasinya, then I will be stressed, considered stress. So I need to go and see a counselor, so I need to release it, I need to de-stress myself. And then, but if I don't do that, when the percentage of my pressure or stress increases, then I go into depression. Now, bila depression ni berlaku, then I need to go and see a psychologist to get a therapy. No? But kalau therapy also I didn't do, but my stress level is increasing, then apa jadi? So I will be reaching a level whereby I will be mentally ill. Then I need to see psychiatric to take medicine. Okay? So now this is the equation. You see, this is the inner health equation. Now, inner health equation, your life pressure, tekanan, kehidupan dalam seharian, let it be studies or work or environment or anything, the pressure that we get is equivalent to external influence divided by internal energy. Okay, now external influence is something that's beyond your control, luar kawalan, whereby like the temperature in your house, if you don't have aircon and fan, you cannot control, no? The rain, okay, the flood, and the coronavirus, which is beyond your control, okay? But then the internal energy, which is within your control. So now, if my internal energy is higher, then definitely my pressure is lower. If this is same, a person in the same situation with a higher internal energy will have a lower pressure. So what will happen if he begins to meditate? Then his internal energy increases. Okay? So from this situation, his pressure level will become like this. So the threshold for him to handle the stress will be higher. So people will be stressed, but he can handle it better, no? Okay? So these are the things that I would like to share with you today. So for holistic health, kesihatan keseluruhan, the overall holistic health, the most important thing is that for me, okay, besides doing the physical, mental, and other things, is my internal strength. So one of the way to increase my holistic health is to practice meditation, because I need to understand myself. Saya mesti faham siapakah diri saya. Saya mesti kenali diri saya sebagai satu jiwa di dalam badan ini dan menggunakan badan ini sebagai kenderaan untuk experiencing and also untuk expressing. Okay? So I hope that you all have got some information today. So with that, I would like to thank everyone.
Thank you very much, Brother Murli. Very beautifully and in a very nicely he explained to all of us about the internal power and how meditation helps to increase the inner strength, internal strength, and how one can be holistically healthy. Thank you very much, brother. Now I request our another eminent speaker, Dr. Hemo. He is a physicianist and he is interactive and functional medicine based in Kuala Lumpur, Malaysia. His main focus is on the individual as a patient, not just externally, but even internally. Centered and science-based approach he always does with his patients. He views the whole body as one integrated system rather than a collection of independent organs divided as has been believed by the medical scientists. Each patient's genetic, biochemical, lifestyle factors, and other things he takes into account, and thus whatever data he collects and he focuses on are directly personalized, and there is a holistic treatment, and thus he goes to the root cause of the disease. And he also is a certified physician from ACNEM, that is Australian College of Nutritional and Environmental Medicine. He is a fellow member of International Association of Cell Therapy, Switzerland, and Stem Cell Transplantation, USA. Brother Hemo is also a Raj Yoga meditation practitioner, and he is connected with the Brahma Kumaris medical wing. I request Dr. Hemo to please speak. Over to you, sir.
Thank you, Sister Vidya, for a very humble introduction, and also good morning to Dr. Rajashekar. Thank you for having us here today, and my fellow speaker, Dr. Murali, and my fellow esteemed doctor colleagues in India, and also, of course, I'm not forgetting all of our medical students who are currently based in India and attached to this beautiful program. So it's great to have you all here today. So the topic that I'll be discussing will be focusing mainly on physical aspect of achieving holistic health for peace and happiness. And how is this done? It's going to be through integrative and functional medicine practice. Many of you might not have heard of this particular practice or division of practice before, but I'm very sure by the end of these slides, you will know what it is and what are the scope of this particular practice. So to begin with, let me tell you what is currently happening in the world. We can look at the global disease trend. If you look at the incidence rate of most chronic diseases in the last 30 to 40 years, they've increased tremendously, very, very significantly. I can ask you a question. Despite all the advancement in medical diagnostics, science and technology, why is it still happening? We should have lesser and lesser diseases, right? As we progress scientifically. The lifestyle and dietary factors are said to be the leading risk factors for death and chronic disabilities. If you look at the global pattern of mortality and death, showed diseases linked to nutritional aspect are the two main factors. Okay, so we can actually see this in the global burden of disease publication in Lancet. It's actually a medical journal, 2017, and I've given the particular citation as well as where to go and find it. Okay, I also will be mixing a little bit of English with Malay for those students, Malaysian students. And before I take you through what is happening in the world, I want you to bring your awareness to these 5 regions of the world called blue zones. Okay, maybe some of you would have heard of them, maybe some of you not, but these are existing zones in the world right now. We call it as longevity hotspots. People who live in this zone in California, Costa Rica, Sardinia, Italy, Icaria, Greece, and Okinawa, Japan, are living very, very healthily, way beyond 100 years, and they don't have much diseases like us. They're actually very isolated community, very little interaction to the world outside, but they all have certain things in common, which are they move a lot. Okay, they don't probably have that much of access to computers and science and technology, so they really move a lot. So that shows that they have a lot of active physical activities, and they have the right outlook in life. They're very positive people. They eat very wisely. They eat mostly very clean diet, which I'll be talking to you all about later. And they have the right group of people, like-minded people, thinking the same way. They have very collective thought, and they're very positive people. So these are the some of the points that were actually noticed in this group of people, which also going to be very, very important when it comes to dealing with diseases later on. Let's talk about what has changed in the last, I would say, 100 to 200 years of human history. These are the 6 main factors that I believe have been occurring in our population right now. So we have been increasing overfat. So what I'm trying to mean by this is basically we are eating more than before. Now, of course, considering that there's also a level of poverty in the world, I'm sure there are parts of the world that people are not getting enough food. But generally speaking, we are eating more than before, but we are still being malnourished. So I want you to bring your attention here. Kita bawa fokus kepada bahagian sini ya. So kenapa ini berlaku is because the food we are eating is actually not nourishing the body. We are eating mostly for the sake of eating to please our taste buds. So the malnourished is still going on. And the people are getting more and more sedentary. Sedentary maksudnya tidak banyak ada activity. They're always sitting around, not much of movement, not much of intentional movement. They become socially isolated, and science and technology has played a lot of role in this. We're always in our phone, in our iPads, in our own computer desk, and we're not mingling and talking, interacting with people like what we used to do. And we're getting more and more sleep deprived. We're sleeping lesser than we have to, and our sleep quality is being affected. And of course, I'm sure most of you know that we're also being sun deficient, because by the time we wake up in the morning, we hardly see the sunlight. And by the time we go back home in the evening, the sun is already down. So this is what's happening in the global world population right now. And it's got a lot of risk factors involved in actually eliciting diseases. Later on, I'll be explaining to you. Okay. And if you look at what has changed in the last 100 years, these are the main factors I would like to highlight. Let me take you through what it means by high processed food. Makanan yang diproses. Makanan diproses basically means food that are very high in salt, which is very common, refined sugar, sugar that has been processed, not in its original form. It is being processed chemically and been included in the food. It is very, very common nowadays. If you walk down an aisle in any supermarkets, and if you see any food that you buy, you will see sugar added at the back in the ingredient. Please mark my word, you go and check it yourself. You will see it. Because sugar was been actually initially used as a way to preserve food sebagai pengawet makanan. Ya. Sugar, gula adalah satu pengawet makanan yang sangat murah dan senang dipakai. It's a very cheap and easy to use preservative for food. And they're using a lot of trans fat. It is a processed, artificially processed fat that is being included in the food to increase the shelf life so they can last longer on the shelf. There are more and more animals, they're being farmed rather than grazing freely, and they have been fed chemical food, not natural food. Yeah? So they are mixing in their body. And also we have been consuming the excessive amount of dairy and gluten. So I'm not saying dairy is bad, but if you consume dairy excessively, especially the dairy products, ya, sumber tenusu yang kita minum ataupun pakai sekarang, is actually been processed. It undergoes certain purification process where it really removes the nutrients from the milk. And also gluten. Gluten is actually a component of wheat that is actually, if you take it, most people are sensitive to gluten. The only thing we don't show it because it always precedes a history, precedes a disease. Gluten can cause inflammation at your gut level that later on transforms into a disease. And the other important factors are basically mineral depletion. So what it means by mineral depletion? The US and British Department of Agriculture data that goes back, I think, about 950 and 936, respectively, has shown that there is significant reduction in the levels of calcium, magnesium, copper, sodium in vegetables, and magnesium, copper, iron, and potassium in fruits. Okay, so I have data from US and Britain at the moment, but I'm sure it's the same all over the world because the agriculture practice is almost similar all over the world. So what I'm trying to say is that the carrot that we eat today has very little nutrients in it compared to the carrots that grown a few decades ago. Why this is happening is because the modern intensive agriculture method have actually stripped increasing amounts of nutrients from the soil in which we grow our food. And the other important aspect is actually loss of food selection and food preparation. So if you can see that a lot of us tend to stick to a very common way of eating. We eat almost the same food in the morning for breakfast, lunch, and dinner, and mostly consists of processed carbohydrate rich in sugar, very little vegetables and very little fruits compared to probably a few hundred years ago. And then everyone wants it very quick. So that's why the fast food industry is very prevalent now. And when you don't really indulge in food preparation, I mean, like a few hundred years ago, we used to pickle food. We used to preserve food in its natural form. We don't use any chemical preservatives. And also we spend time preparing food at home. You know, we buy the vegetables, we wash, we clean, we cut them, and we cook them. Okay, so all this food preparation and selection of food is no longer there in the current modern society because of time constraint. But if you really think about it, if you're really cautious about health, you really want to make a difference, there is always time for doing this. So what has happened is basically the next important factor that has changed is basically the amount of toxin and heavy metals in the food that we are eating. They're phenomenally high. There's so many countless data and studies have done to prove this. There's so much of these chemicals and heavy metals from anything that we apply on our skin right to the food that we ingest. Yeah, daripada makanan dan juga kepada bahan-bahan produk-produk yang kita apply pada kulit kita. Okay, this consists of body soaps, cosmetics, perfume, deodorants, antiperspirants, sunscreen, dry cleaning of the clothes, pesticides in the food, heavy metals in the water, and also a very important component called VOC, volatile organic compounds, in the carpets, furnitures, and paints. So this VOC, I want to bring your awareness to it. Is something probably new, you might not would have heard of it, but every furnitures, carpets, or paints that you probably see, they have an unknown layer of chemical on it, which are actually exuding continuously into the atmosphere, into the air that you breathe. Okay, so this comes under what we call this as sick building syndrome, where they actually meters to measure these volatile carbons in the air. So I go based on one rule. If we can't pronounce a name of the ingredient in the food that you eat or the product you apply in your skin, don't use them. Most probably they are going to fall into the category of toxins or heavy metals. The other aspect that I've talked to you all already about is lack of movement. I know life has become very sedentary, that we hardly move. We probably move to get up from bed to do our daily chores, go to work, sit on our desk for 8 to 9 hours. Probably we get up for lunch break, and then we get up and we come back home, and then we sit, and then we bathe, and then we sit again on the sofa, on the couch, watching TV, and then we go to bed. This is what's happening in most households nowadays. So this lack of movement has got a lot to do with stressing the body. One of the main stresses of the body that I will be talking to you all later about is actually lack of movement. And the other interesting word I want to introduce to all of you is chrononutrients. Chrononutrition is basically, it's a study of how time affects the body. I'm sure you heard of diurnal rhythm, circadian rhythm, you know, medical students out there, yeah? Masa baca tentang hormones and all that, I'm sure you can introduce kepada circadian rhythm and diurnal rhythm. Okay, this is actually how your body is synchronizing with time. And if you don't synchronize with time very well, you're going to increase your risk of developing chronic diseases. Okay, artificial lights that is being exuded from iPads, computers, mobile phone, fluorescent lights in your space, working in a shift work, frequently traveling long distance via jet, staying up late watching movies, partying, and even studying has got a lot of adverse effects to the immune function, as well as the endocrine and gene expression. Okay, so let's move on to the next slide about what will be the future of medicine. You see, the future of medicine is changing. It's a globally, the trend is changing. Probably very subtle, but people started realizing the very normal, the current healthcare model doesn't really help in reducing chronic diseases. Yeah? Dr. Rajshekar has mentioned beautifully that the chronic diseases are on the rise at the moment. And why is it? Because it's because the current medical healthcare model is based on symptoms, not dealing with the root causes. So I'm going to take you through this path of finding out the root causes of diseases by understanding 4 important components here. They are predictive medicine, preventive medicine, personalized medicine, and participatory medicine. So this is what consists of integrative and functional medicine. So what we can do with this model of healthcare system is basically you're able to predict health outcomes in patients. You're able to prevent ill health and diseases even before it begins to manifest. Okay, pencegahan, yeah, pencegahan is actually a model of integrative and functional medicine, and also we can personalize medical care, where we shift from doing what is best for average people to what is best for each individuals. So the medical literatures, the medical practice at the moment is actually based on average. Okay, if I give this medicine to these people with this disease, it's going to work. Actually, it doesn't. Each body reacts differently And each body will present diabetes in a different way, or present hypertension in a different way. They might have a lot of other illnesses along with these conditions. So we cannot assume, one size fits all approach when it comes to medicine. And also, this type of medicine is going to be about actively having patients to participate and take control of their own health. So this changes the perception that doctors are looked upon heroes and saviors and also drug dispensers. Well, of course, doctors are heroes and saviors because, of their work they're being done. But don't get me wrong here. What I'm trying to say is that doctors will still play a crucial role. But instead of dictating to patients that you must take this, you must do this, you must take this medicine, so it's going to move to a more patient empowerment and also patient self-care approach. So in a nutshell, how would I define functional medicine, integrative medicine is, functional medicine determines how and why illnesses occur and restores the health by addressing the root cause of the diseases for each individual differently, not everyone, not common for everybody. So what happens is that in functional medicine, it requires a very detailed understanding of each patient's genetic, biochemical, and lifestyle factors so that we can personalize treatment plan for optimal health. So what we do in functional medicine is that we spend close to 1 hour to 1.5 hours just getting detailed history and examining them. Okay, we study literally everything about the patient's health, from the day they were born right up to the point where they're seeing you. It makes a lot of difference because the body undergoes so much of changes during the entire lifespan, not only during the very short period of time. By doing so, we can actually identify the complexity of diseases. We cannot take it just by what is being presented to you. Patient comes to you with diabetes, we cannot say, this is diabetes, type 2 diabetes, I'm going to deal with it this way, and that's it. No. There could be a lot of other complex issues that actually relate to the diabetes, you might not even realize it. Okay? All right. So what I will do is that I would like to break it down to these very 5 important components that stresses the body. Yeah, stress kepada badan ni ada 5 komponen utama. If you can actually group all these causes of disease into these 5 main categories. In these categories, each component, when the body deals with the different stresses, it's going to result in diseases at one point or other. So let me take you through these interesting components one by one, so you get an idea what I'm talking about. When I'm talking about physical stress, is basically, I'm talking about lack of movement, like what I mentioned to you earlier. And also excessive movements. So what I'm trying to say by excessive movements is that you might notice that people who work continuously, they might not take a break. They will be continuously exerting themselves physically, day in, day out, 30 days a month, 365 days a week without a single rest. And that form of excessive movement also hazardous to the body, because rest and relaxation is also, and sleep are also equally important to the body as much as movement as well. And in the process of doing so, a lot of them are losing posture. You can see nowadays a lot of biomechanical problems. Yeah, problem to do with musculoskeletal, muscle pain, back pain, sleep disc, spondylosis. All this on the rise is because of a posture. We're not looking after your posture when you are standing, when you are sitting down, when doing work. That's actually a form of physical stress. So you can see the relation how these 3 components can actually lead to diseases later on. And mental emotional stress is also very, very important. And this mental emotional stress can come from your own self, either from the family members, at your workplace, colleagues, and your employers, bosses, as well as friends. And mental health is by far increasing right now. And is affecting many, many countries and many, many people all around the world. And the next important stresses that I would like to take you into is basically nutritional stress. So the two important components I would like you to understand is that modern population right now can fall into two categories. They're either being overfed and undernourished, or underfed and undernourished. Right? So what it means basically, maksudnya, we eat excessively and we're lacking the nutrients, like what I mentioned to you. And some of them don't eat, at the same time they're having lack of nutrients. I'm sure you can relate this easily. Yeah? For example, a common breakfast everyone goes for is basically bread, cereal, and carbs related food. And it's always the same component every single day. I would say probably 3 to 5 times a week. And basically the same variety of lunch and dinner also being consumed. So you see the body there are almost 3,500 biochemical reactions that actually needs all the different nutrients that are lacking in the soil that I mentioned to you before. Magnesium, copper, zinc, selenium, all these important components that actually makes up a very, very important biochemical pathway in the body. Without them, the body is definitely going to go into diseases. And you don't get it if you're being undernourished. And more food additives, coloring, preservatives, pesticides, and various other chemicals are being used that actually leaching away these nutrients in the body. Okay. Semua chemical buatan manusia akan menyebabkan kekurangan nutrisi dalam badan. Ya? And the other important stresses to the body is actually environmental stress. So we cannot downplay the importance of the environmental stress to the body, because we are breathing in air every day. We are drinking water every day, and we are constantly exposed to the land. And we are having a lot of electromagnetic radiation that's coming from all these wireless connections. They have one point going to result in damage to the body. And finally is genetic stress. So I put this as the last component because when it comes to genetic stress, it is not really easy to handle, but it can be dealt with. But it takes a lot of work, and usually it comes down with dealing and speaking to the healthcare providers and doctors to deal with genetic stress. So these are inherited stress that comes due to poor genes. So this actually in a nutshell to explain to you how we can deal with these individual stresses. I've given a very basic pointers here. Of course, we can go very deep on this, but due to time constraint, I'm going to give you in a very nutshell. When it comes to physical stresses, so basically, this is where I'm trying to highlight to you that modern medicine way of delivering healthcare does not consider all these things. It's the allopathy is basically drug-based therapy. You cannot treat drug-based therapy to address all the different stresses. You can see, clearly you can see where is the fallback here. This is the fallback of modern medicine. See, when someone comes to me with a back pain, and of course the practice in allopathy is basically to give them, non-steroidal anti-inflammatory drugs and, put them on some patches and some ointments and send them back, right? They're going to keep coming back because you did not address the root cause of the disease. Basically, probably is having a poor posture. He's probably not sitting well. He's not exercising, strengthen the back muscles. And also probably not exercising the back muscles or problem. So that is why integrating your practices with this sort of factors is very important. So basically, I would advocate more exercise when the patient is able and do more intentional movement. Probably if the person is very obese, can't exercise the way you want them to do, you tell them one thing: have intentional movement. What it means by intentional movement is basically tell them to walk more rather than sitting down. If you park your car, you're going to walk towards it. Let's say you want to walk to your college. Park your car probably at least about 500 meters away. Take the stairs instead of the elevator. And when you're sitting on your desk, get up frequently and walk to fetch water or to the washroom, and start getting this intentional moving going. And look after your posture. This can be done either you go to a chiropractor, you go to an osteopath, you can go to a physiotherapist, who can regularly, improve your posture as well as your back muscles and your bones. When it comes to mental stresses, I know allopathy deals with it by prescribing antipsychotics, antidepressants, anti-anxieties, who have a lot of significant adverse effect to the brain. I think we know about all that. But the most important part is that when it comes to mental stresses, basically sleep. You got to talk to them into sleep hygiene, how to advise them on proper sleep. There are methods to practice before someone goes to sleep. Basically, there's no exposures to TV, blue lights, 2 to 3 hours before you sleep. Do some light breathing, have a warm shower, eat very light meal at night. So all this will help to induce a good sleep. Don't watch TV, violent shows, something that is exciting your brain, so that will actually affect your sleep. And also, it's always good to go to sleep at least by 10 to 11, because your body goes into a pure state of healing between 10 to 2 o'clock in the morning. So nature has given us time to heal, but that's the time between 10 to 2 that we want to stay up. We're actually disrupting the natural healing process. And breathing, the importance of breathing cannot be overemphasized, because most of us are basically shallow breathers. Okay, what happens when you breathe shallow? Bila pernafasan kita tak dalam, we're not going to get enough oxygenation in your blood. The cells in the body are not going to get enough oxygen. If you notice that most of us are breathing from the lungs, we are breathing from the lungs, but what I mean is that we got to breathe from the abdomen. So when you breathe in, you got to get the abdomen to expand and move rather than the chest. So when you're doing abdominal breathing, you're going to take in a lot of good oxygen into your body. You're going to oxygenate your cells even more, and the delivery of good oxygen to your cells is going to be even better. And the other component of mental health is basically meditation and yoga. I cannot emphasize, our dear speaker, Dr. Murali, has spoken about the importance of how meditation and being in a constant practice of yoga and calmness in your mind can actually enhance your mental disorders. The other third component that we've talked about, nutrition, is basically by advocating organic, basically food clean from all sort of chemicals, and wholesome food. We call it the whole food. Consists of all the different components of food that you've been talking to, patients and people, carbohydrates, proteins, and also fats. Healthy fats are all important, need to be included. Not just one-sided approach, just purely fat, purely sugar, purely carbohydrate. And when you go even deeper, when practitioners like us at functional medicine, we actually can give targeted nutrient hormonal therapy to address individual deficiency that we can actually detect through a blood test. So if you can't get an organic food, which is definitely not easy in the current state of the world, I'd advise you to clean your food thoroughly. Use either baking soda, okay, sodium bicarbonate, mixed with some salt, to clean your food thoroughly, to remove the components before you eat. There's one interesting study to show that a person who's eating organic food, they've noticed that they have 1/6 of the chemicals that are actually found in the people who don't eat organic food. I wouldn't say organic food 100% is devoid of all chemicals, but there are certain amount of chemicals definitely, because it's still grown on the soil, which are definitely filled with some chemical, but it's 1/6 lesser than the normal people. Okay, the other component is the environment, persekitaran kita, So what we need to do is basically to deal with environmental stresses. We have to understand the importance of detoxification of the body. So this includes either going on fast, okay, or taking in certain procedures even in Ayurveda, and some of the other complementary medicine advocates the certain methods of detoxification to clear these toxins out of your body. Okay, what important easy things you can actually do is through sweating, sauna, steam bath. When you perspire, you're actually removing a lot of toxins from your body. The second method is actually fasting. So when you actually, most of us actually, we like to eat even though when you're not hungry. We take a lot of simple snacks in between. So I advocate a fasting. Try to have your dinner at least before 8 at night, and try to go through at least the next 12 hours if possible. If can't, the 16 hours in order to detoxify your body. But take it slow, and please do this under the guidance of your healthcare professional, your doctors, and before you embark on fasting. So when you fast, your body goes into a natural healing and detoxification. And as much as you can, try to breathe purified air. And a simple investment like getting a purifier, or when you know that place is actually filled with toxins, wearing a mask will help, because you want to reduce the environmental stresses that are going into the body. And drink filtered water if you can. Okay, and try to use non-toxic natural products as much as you can in your life. If you already have, don't throw them away. Finish using them. But when the next time you buy something, or when you try to consume something, have this thought in your mind: are these natural? I only go by one rule that I mentioned to you earlier. If you can't put it on your skin, then if you can't pronounce the name of the ingredient on the product you put on your skin, don't buy them. They're definitely toxic. They are not natural. If you pronounce names of chemicals in the food that you're buying, don't buy them, because they're definitely chemicals. There are so many cancer-causing food being used by the food industry, and they're not even sanctioned by the governing body. These are all in the form of artificial colorings and preservatives and all that. There's one interesting study that was done where they analyzed cord blood of the fetus, the babies, okay? And they noticed that there were 280 chemical compounds in the cord blood of the baby that yet to be born. Okay, bayi yang belum lahir, dalam dia punya umbilical cord tu ada 280 chemicals, and out of which 180 chemicals are actually carcinogens, the cancer-causing chemicals. I would say about 208 of them can actually cause birth defects in animals. They tested these chemicals and actually can cause birth defects in animals. So imagine the amount of toxins the mother has consumed that is available to the fetuses, even in the cord blood itself. I want you to remember the importance of environmental stresses. And lastly, genetic. In terms of genetic, a lot of people say, I can't do anything. Genetic is something inherited. I can't do anything about it. Yes, you can. You can intervene earlier. If you know that you've got a very strong history of cancer in your family, very strong history of metabolic problems like heart disease, diabetes, hypertension, you got to start looking after yourself from very early stage of your life. Careful with your diet and follow all the different components I've listed to you earlier. And definitely the gene part of it will not manifest as much as the person who did not follow this. And have the right knowledge, empower yourself, read frequently, get to know the truth about food you're eating, supplements you're consuming, whatever devices or facilities you're using. Okay, so we're coming to the last two slides of my presentation. So what methodology that I often use in approaching all my patients is this 5 steps. Not just for me, it actually can be applied to all of us. So 5 peringkat, 5 langkah untuk diikut, ya, actually to your own self-care. First of all, from the 5 stresses I mentioned to you, identify which stresses that you have. Number 2, obtain the right information and knowledge about those stresses, even before you see the doctor. Get all the knowledge, read at the right, websites. Now don't go into just Wikipedia alone. There are a lot of good websites, good information, good sharing in the internet, you can actually get it. And after that, when you see your doctor, when you see the practitioners, when you get all the information, you do your blood test and everything, and you know what you need to do based on what I've highlighted to you earlier, set the intention first in your mind. Most of us, we get on with things to do immediately. We don't take a moment to think, this is what I need to do. I'm going to set intention. This is very important because, as you know, what Didi Miraben was telling earlier is that we often fail to acknowledge the presence of mind component in our body, soul component. So you got to acknowledge it by setting an intention that this is what I want to do. This is the path I'm going to follow. And then you act accordingly. And lastly, you're going to execute the intention with your body. For example, if you need to exercise, you're going to do it. You need to look after your diet, you're going to do it. You're going to do certain what do you call advice I given you earlier. You got to do it with your body, you got to do it. And final step will be re-evaluating and improvising your methods from time to time. Okay. And with that, I would like to end with this note that you can't mitigate or address chronic diseases with drugs alone. You need to address the root causes of these diseases. Deal with them one by one and work your way up to optimal health. With that, many thanks to all of you for listening. Thank you very much.
Thank you very much, brother. A very nice and easy method to become healthy, overall healthy, physically as well as mentally. You have shared very nicely the components which are affecting our body and how each organ is connected with another one, and then how we can collectively bring a change in the body as well as in the mind. Very clearly and nicely you have explained. Thank you very much, brother, for your nice and explanatory way of bringing to us to the notice of us. Thank you very much, brother. Now we have a question answer session. At present, we don't have any such type of question with us by the students. So, Dr. Rajshekar sir, can we go further now?
Are there any questions from students? Are there any questions from students?
ಅವ್ರಿಗೆ ಚಾಟ್ ಮಾಡ್ಲಿಕ್ಕೆ ಹೇಳ್ಬೇಕಣ್ಣ. They should write on the YouTube channel or on the Zoom.
Hello, can I
Hello.
say something? Hema Varman, can you hear me?
Hi, doctor. Yes, I can hear you. Yes.
Very nice. I am extremely happy. Your, very in-depth assessment of what is happening today to all of us. I always say as a physician that drugs are not panacea for all diseases. Unfortunately, modern medicine has revolved around drugs all along. I just want to ask you, how long we have been practicing this? How many patients you have seen in the last 1 year? We have improved a lot after this therapy. Yes,
Okay.
out of curiosity.
Okay, I've been in, I actually gone through the mill like every other doctors, where I've been in internal medicine for quite some time, getting my routines and my basics very strong. And I've been actively advocating functional medicine for the past, I would say, 7 years of my life. And I did a lot of cancer and metabolic disorders. And when these criteria that I've outlined to you are met, and we do see in patients complete reversal of diseases. And it does happen at one point. It might take some time, because this is where patience is needed amongst the doctors, also the patient themselves. Because if they want a quick fix, they go for drugs. But in order to heal a disease, because the body is very forgiving, but when the disease is already manifested, the body won't forgive you that easily. It takes a lot of work. So what I do is I take them through the process. When I identify the stresses, I deal with them one by one, and you can see the miraculous healing aspect of the body. And I actively treat a lot of metabolic problems, a lot of hormonal issues amongst the women, and I can see good improvement on overall conditions, as well as in some cases, complete reversal of diseases.
What is the complaints rate of your patients after you advise them to do a particular thing? How many of them are compliant?
Okay,
And do seriously.
okay, the compliance rate, I would say it falls under the chronicity of the problem.
Right.
So when they come to me with very chronically ill, the compliance rate is usually higher. I would say a good 80 to 90%.
Okay.
100% is impossible because they've lived their life the entire lifespan, and changing everything is not easy. Although I would say in my practice, I would say less than 10 patients who have been 100% compliant. So they take every word that I say and follow it through, and they see remarkable changes in their life. I would say that by addressing each components accurately, longevity is not an issue anymore. We can actually even live like the people in the blue zone areas.
Right, right. They must have exhausted all doctors and all hospitals before coming to you. I suppose. As a last resort, they say, all right, let us also try him or one.
That's my main idea of propagating functional medicine is to try to make it mainstream, because we take into our practices is very much back to the basic biochemistry, physiology, which until now I'm still flipping my physiology biochemistry books because it goes down to the very fine details which are often overlooked when you're doing a drug-based treatment.
Right. Very nice.
So correct nutrients. I'm still using Krebs cycles until now to understand. I use Krebs cycles, even the folate cycle, the methylation pathways in the body. And when I treat them, you can see remarkable changes in the body.
Very nice. I'm extremely happy to hear this. I only hope my students will take a bit of this advice when they practice in medicine in future in Malaysia. Very good. Right.
Thank you.
So thank you very much for all the things, whatever we have got now. So knowledgeable, so interesting, and I hope that all of the members who have attended here, they have enjoyed it a lot. We got more information. It was so clear that brother, even we also being a non-medical student or not concerned with the medical field, even as a layman, we could understand very easily what is happening actually at the physical level as well as at the mental level. Thank you very much to both of you. Now I request Sister Dr. Sangeeta to place vote of thanks to all the eminent speakers and also the audience. Dr. Sangeeta is a assistant professor in A.M. Sheikh Homeopathic Medical College, and she has been practicing meditation since 20 years, and she is always with us. I request Dr. Sangeeta to please say vote of thanks. Dr. Sangeeta?
Om Shanti. Yeah. Om Shanti.
Om Shanti.
Respected
Om
Divine
Shanti.
Sister Rajyogini Mehraji, Rajyogini Ambika Bahenji, and Divine Brothers Dr. Murlindran, Dr. Hem Varman,
Okay.
and Dr. H.B. Rashekar to have this occasion. I, on behalf of Medical Wing of Brahma Kumaris, Belgavi, and USM KLE International Medical Program, Belgavi, extend a very hearty vote of thanks to the honorable delegates who blessed us with their presence in their busy schedule. I must mention our deep sense of appreciation for Dr. H.P. Rashekar, Director, USM KLE International Medical Program, Belgavi, for giving us an opportunity to organize this webinar. Also, I would like to extend a special thanks to Rajyogini Meera Bahenji, Director of Brahma Kumaris from Malaysia, for inspiring us. I especially thank Dr. Murindran, Head of Robotics and Intelligence System, University Malaysia, and Dr. Him Orman, Interactive and Functional Medicine Physician, Malaysia, for enlightening us with their knowledge. Thank you, sir. I also wish to express my gratitude to our director, Brahma Kumaris Belgavi, Rajogini Ambika Bahenji, for providing encouragement and constant support for this webinar. I am very grateful to Medical Wing of Brahma Kumaris for giving us an opportunity to organize this event. A special thanks to Vidya Bahenji from Angol, Belagavi, who was an instrument for this webinar. As no program can be successful with a single person. So I extend big thanks to all our volunteers, technical supporters, and other people also. Thank you one and all. If I have missed their name, thank you. Om Shanti.
Thank you. Thank you very much, Sister Sangeeta, for extending thanks, and thanks to you also.
Thank you.
Now, lastly, I would like to request all the participants and members to please give feedback about this program, because they will be extremely helpful to us to improve ourselves to serve you in forthcoming events, because this is a continuous process, and as Brother Hemo said, it is a collective work to be done to improve ourselves, to improve the society. So I thank everyone once again for being part of this webinar, and thank you very much to one and all.
Thank you, Vidya. Wonderful work. Keep it up.
Thank you.
We'll again do similar thing in future. Now we know where we stand. We also know how effectively we have done it now. Kindly send me the emails of both these Murudindran and Hemo Orman to me later. They're excellent speaker. They have done an excellent job. On behalf of USM Medical College, I sincerely thank them. Wonderful work they are doing. I only hope sometime in future I'll invite them to Belgaum to give a lecture to our students in Belgaum.
And Brother Murli, I would like to tell that in 1990, we had an international health conference from Mount Abu. Dadi Prakash Maniji and all the medical field group had come here. And it was an international conference, very nicely held. At that time, it was a big project in Belgavi. And that was conducted by Dr. Rashekar. So he's inviting you, and you please be ready for that, and he will definitely do it, I'm sure.
But after COVID pandemic, I will invite them.
Of course. That is there.
Thank you. Good day. Om Shanti. Om Shanti.
Om Shanti.
Shanti.
Om Shanti.
Om
Thank
Shanti.
you.
Thank you.
Om Shanti.
Om Shanti.
ಇದು ಲೈವ್ ರೆಕಾರ್ಡ್ ಆಗಿರುತ್ತೆ